Yeah, thank you for having me today, because this is really one of the most important aspects. Unfortunately, prostate cancer is something that is what we call a silent killer. So you may not know that you have prostate cancer until it's too late. And that's why we have very clear screening mechanisms for this. And the invention of the PSA in the late 80s really revolutionized our care for this disease. And I was recently made aware that your own father, was a prostate cancer survivor, likely due to the fact that he had his PSA checked. And so PSA is really the important thing. So while you may not, you or your husbands or significant others or family members may not know that something is brewing within them, the most important thing is to have a close relationship with your primary care provider or your urologist and get screened early, and then make an informed decision from there.
And this is the important point for the viewers today who are waiting to hear that magical, oh, if this occurs, you must go to the urologist. Yeah. Just like colon cancer and how we do colonoscopies, no matter what the symptoms, most of the patients have no symptoms with prostate cancer. And most of the patients with colon cancer that we find, or polyps that we find, don't have symptoms. So for the viewers today, for mom or the wife at home or the man watching today, if age 55 comes across with or without symptoms, the man should be screened for prostate cancer. Or if there's risk factors, African Americans, Afro-Caribbeans, patients with a family history, age 45, come and see Dr. Weiner, or more importantly, really just see the primary care doctor. Most of our patients in GI and gastroenterology, and I'm sure in urology, are referred over by a primary care physician. And so that's important. So for the viewers today, Dr. Weiner is telling us you don't have to wait for a symptom, and you shouldn't wait for a symptom. Because then it might be too late. Let's talk about some of the other urologic conditions that men out there might be interested in. We'll briefly touch, with some of the time we have left here, about erectile dysfunction. Could that be a sign of cancer?
So the mechanism for the men's erection is totally separate from the prostate. So typically erectile dysfunction is not associated with prostate cancer or any of the other urologic malignancies. Erectile dysfunction is more a side effect or an associated symptom of cardiovascular or
blood vessel disease.
Yeah, blood vessel disease, exactly. High blood pressure, diabetes are the two most common causes of erectile dysfunction.
And it can attack any age.
It can, as early, in men in their 30s, we sometimes see with some,
especially
evidence.
A diabetic 30-year-old, a hypertensive 30-year-old.
Well, nowadays with the obesity epidemic, more and more early onset diabetes, we're seeing patients younger and younger.
Right, so not necessarily a sign of prostate cancer, not usually, but a common condition, and more common now because of all of the diabetics that we see and the high blood pressure patients. Erectile dysfunction, not something to be ashamed of. They should come see you. There's options for treatment.
Absolutely. Yeah, the options run the spectrum. I mean, sometimes erectile issues can be psychogenic, meaning just, anxiety, or not necessarily a medical reason. And so sometimes it just needs a little bit of encouragement. And then it runs the whole spectrum of medications, and even some surgeries can help. So,
So erectile dysfunction, we talked a little bit about that. There's treatment options out there. Unless you see a doctor, you're not going to get the full treatment available to you. So it's important to see the primary care urologist if needed for erectile dysfunction. We touched a little bit, and I know the men out there are watching because, when you're on the airplane and that fasten seatbelt sign comes on and all of a sudden you got to go, or you're waking up in the middle of the night and you see the bathroom quite a few times because of the growing problem we touched on. Let's talk about that, because we said that that's probably not a warning sign of prostate cancer, but it is a sign of BPH, benign prostatic hypertrophy. When you evaluate a patient who says, hey, I'm going a lot, I've got some trouble peeing, I can't get the urine all out, I make 10 trips to the bathroom, my wife wants to throw me out of the house, we can't, every time we try to leave the house, I'm going back to the bathroom, and it's frustrating. Tell us, what are the treatment options out there for this?
It's funny that you mentioned that. So one of my favorite things is that men with BPH or symptoms of BPH typically know where every bathroom in their local vicinity is because they've mapped it out.
So true.
They even on a family trip, they know where all the locations of the bathroom are. So first of all, BPH it's a diagnosis, but it's more of a symptomatology, right? So it's the going to the bathroom too often, having to rush to the bathroom, not feeling like you're completely emptying, feeling that your urine stream is very slow, waking up too many times at night. So a lot of people will come in and say, yeah, doc, I don't have any trouble going. I pee regularly. But the problem is that over time, these symptoms happen over many, many years. And so they don't realize that this is actually abnormal. And so first thing you want to make sure is that your PSA is okay and that this is not a sign of late-stage prostate cancer, which can grow and block off the urethra and then cause these obstructive symptoms. Once that has been set aside, once it's definitely not cancer, then we have a number of options. This is one of the most common urologic conditions that we deal with. I would say probably half of the men that we see in our practice have some sort of urinary issue, right?
Someone might have already gotten up while watching this show to go to the bathroom because of
welcome
this.
back.
Welcome back to the show.
Right. So the beauty is that in our current armamentarium, we have a tremendous number of great medications to treat this. Running from the Flomaxes of the world, which you may have seen on the TV, to the finasterides, which help shrink the prostate. So we can both relax the prostate and shrink the prostate with medications. And if medications don't work, we have very simple procedures that can quote-unquote open up the prostate.
My patient told me the other day he went for the Roto-Rooter.
Perfect. Exactly.
What is that exactly? Explain that a little bit.
So what he's referring to, or the patient's partner, significant other, is referring to is it's called the transurethral resection of prostate, or a TURP.
TURP, right.
Yeah, colloquially known as a TURP. And basically you enter into the man's urethra and you essentially shave out the inside of the prostate, or core out the apple, and open up the channel to allow the urine to flow freely.
Important, yes, because you're right. Men will start to live with this and not realize that they have a problem, but the family realizes. They're like, oh, dad's going to the bathroom again for the 5th time this hour. Or you see a man climbing a fence to find the bathroom somewhere because it can be really painful, or the urgency can be there.
It's amazing. Some of the patients that we treat for cancer are very happy and thankful, but the patients who feel the most benefit are the ones
with the benign,
with the voiding dysfunction relief.
So another topic that we should touch on also for the men watching, and women too, because this can affect both, is kidney stones. The rocks, the diamonds, the stones, these painful, and when we show them to patients, they can't believe such a little stone caused so much pain. But let's talk about nephrolithiasis, kidney stones. And what can someone out there who has been diagnosed with kidney stones in the past do to prevent getting kidney stones again?
Well, as a stone former myself, and I was treated at my own institution, which was
Did you treat yourself, or you had a friend?
We had another consultant come in.
Okay, great.
It is a very painful thing to go through. I won't equate it to delivering a child, which a lot of people do out of respect for my wife, but it is extremely painful, and it's something to be aware of. Family history is actually one of the most commonly associated risk factors. There are a number of risk factors.
So here we go blaming mom and dad again.
Yes, exactly.
Okay.
But family history is extremely important for stone formation. The most important thing to prevent stones is to stay well hydrated, particularly in the summer months. And one thing that people aren't aware of, but is actually very helpful to prevent stones, is to put a little bit of a citric acid fruit, like a lemon or an orange or a grapefruit, into the water that you're drinking. And that can actually help prevent the formation of stones.
So a little wedge of lemon or lime might go a long way. Get some extra vitamin C.
Yeah, we say drink over roughly 2 liters of water a day, which seems like a lot, but it's very important, especially if you have risk factors.
Hydration is key, I think, also for what we deal with constipation. Yeah. When I talk to my patients, and you take a good history, we don't drink enough. And it's got to be water. It can't be soda and caffeinated beverages, because they actually dehydrate us a bit.
Exactly.
So a little bit of lemon or lime, a little bit of citrus in our water can help prevent stones. The treatment for stones these days, what are you doing for patients who have stones that won't pass on their own? Right.
So a stone less than 5 millimeters or so will typically pass on its own. So we can just observe them, wait for it to pass. Larger stones, we have to use some more sophisticated techniques. We can use shockwave lithotripsy, which is outside of the body for a smaller stone. We can use a small camera and a laser to fractionate a stone and break it up and get rid of it that way. And for bigger stones, sometimes we have to actually go through the back and use almost like a little drill and break up these big stones. But all of which are minimally invasive, and patients recover exceptionally well. Unfortunately, once you've developed the stone, you're at risk for developing more. So roughly 50% of patients who have developed a stone will have another one at some point in their future.
Right, so the basics of kidney stones, very painful.
Yeah.
Can be prevented with adequate hydration.
Yep.
Might be blamed on mom and dad because we can't change our genes, our DNA. That might put us at risk. But there are treatments out there for this that are minimally invasive. Small stones less than 5 or 6 millimeters?
Yeah, roughly.
Right, so if a patient has a very small stone, they often leave the emergency room with a little basket to catch it in.
Right.
They're told to strain their urine.
And some medication, exactly.
Right, and it should pass on its own. Very interesting. So kidney stones themselves, do they affect men or women more?
So it used to be men were more affected, but in recent years we've seen a shift towards women, actually. Women have recently surpassed men in terms of prevalence for kidney stones.
But affect both men
both.
and women.
And we see a rash of them develop in summer months, as you would expect, because people tend to drink less and become a little more dehydrated.
In the last few minutes we have, we always like to get to know our doctors a little bit more personal. We want to know more about you. So I think I mentioned earlier in the show, we're going to go over now to our Kings County questions here.
Okay.
So this is a local Brooklyn show. We're going to ask about some local Brooklyn questions. I think you mentioned that you're a transplant, or are you Brooklyn native?
I'm originally from Northern California and transplanted to Brooklyn.
Welcome to Brooklyn, welcome. Likewise am I. I'm a transplant as well. So, favorite restaurant in Brooklyn? I know you've been here long enough to figure this one out.
Yeah, we're going with Della Rocco's Pizza.
Ah, pizza. Everyone in Brooklyn likes pizza.
Yeah.
Mets or Yankees?
Oakland A's.
Oakland A's. I knew it. Oakland A's. Knicks or Nets? Where
Golden State Warriors.
Golden State Warriors.
And I'm not a bandwagon.
Brooklyn patients. I don't know if you're going to go to this doctor. Let's see.
Yeah.
Well, thank you for being here. This is an important topic. All the men out there, and I am sure all the ladies who are concerned about their men, have benefited from all the information. Get screened for prostate cancer. It is a preventable disease. Detected early, it can prevent metastatic spread around the body. Get your PSA checked, a rectal exam, starting at 55, or if you have risk factors at 45. Thank you for your interest in the show. I invite you to visit our website at medcastplus.com and check out our tools and connect with us on social media. You can also call us at 718-510-2103. Thank you. Stay healthy, Brooklyn. See you next time.